Hey, Sarah. I was just reviewing some medications that require dose adjustments in patients with renal failure. It's crucial to ensure proper dosing to prevent adverse effects, especially in this population.
Absolutely, Kevin. Renal impairment can significantly affect drug clearance and metabolism, leading to potential toxicity if doses aren't adjusted accordingly. Which drugs are you looking into?
Well, for starters, medications like digoxin and aminoglycoside antibiotics require dose adjustments based on renal function. With digoxin, decreased renal clearance can lead to drug accumulation and increased risk of toxicity, so we need to lower the dose in patients with renal impairment.
Right, and aminoglycosides are known for their nephrotoxicity, so adjusting the dose based on creatinine clearance helps minimize the risk of kidney damage while maintaining therapeutic efficacy. What about antibiotics like cephalosporins or fluoroquinolones?
Good point. Cephalosporins and fluoroquinolones also require dose adjustments in renal failure. While some newer cephalosporins may be less affected, it's essential to check the dosing guidelines for each specific medication, especially in severe renal impairment.
And don't forget about anticoagulants like warfarin and direct oral anticoagulants, DOACs. Renal dysfunction can affect drug metabolism and clearance, potentially altering their anticoagulant effects. Adjusting the dose and monitoring coagulation parameters are essential to prevent bleeding or thrombotic events.
Absolutely, Sarah. It's crucial for us as pharmacists to stay vigilant and ensure that patients with renal impairment receive appropriate dosing adjustments to optimize therapeutic outcomes and minimize the risk of adverse effects.
Couldn't agree more, Kevin. By staying informed about drugs that require dose adjustments in renal failure and collaborating closely with healthcare providers, we can help ensure safe and effective medication use for all patients, especially those with renal impairment.